Good day, I'm Stephen McHugh, and this is your JIS News for Wednesday, July 6. Government has announced a $3.8 billion social intervention program targeting welfare support, water supply, and cleanup exercises. The figure is $2.7 billion more than the $1.1 billion that was previously allocated in the budget. A detailed breakdown of the allocations was presented by Finance Minister Dr. Nigel Clarke in Parliament on Tuesday. $550 million has been set aside for persons who are not on the Program of Advancement through Health and Education path. The funds will be distributed through the Ministry of Labour, the Constituency Development Fund, CDF, municipal corporations, poor relief and public assistance departments. 45,000 NIS pensioners who receive less than $15,000 per month will benefit from a pool of $450 million. Meanwhile, $100 million will go towards 10,000 social pensioners. One-off grants will be disbursed through the Ministry of Labour to assist 160,000 PATH students, while non-PATH vulnerable students will receive assistance through the CDF.
We want to do more than we have done in the past, in recognition of the environment that we're operating in.
Further to that, $750 million has been earmarked for the cleanup of parish capitals leading up to independence celebrations in August. The funds will be shared by the National Solid Waste Management Authority and members of Parliament through the CDF.
Amounts allocated via the Constituency Development Fund can be used for beautification, for bushing, drain cleaning, and for activities related to Jamaica 60.
And the Ministry of Local Government and Rural Development will receive $150 million to truck water to areas experiencing challenges. The Finance Minister meanwhile disclosed that government's energy copay program has disbursed over $1 billion in May and June. The program seeks to offset electricity costs for Jamaica Public Service customers who consume less than 200 kilowatt hours during their bill cycle between April and July. The 20% contribution also includes a $3,000 payment for prepaid customers during the period. In Parliament Tuesday, Minister Clarke said almost 484,000 customers benefited in April, while just over 488,000 Jamaicans received the discount in May.
The government is listening to the people. And Mr. Speaker, the government is responding to the people.
In the meantime, Prime Minister Andrew Holness says government is providing targeted support programs for needy Jamaicans while maintaining fiscal responsibility. Mr. Holness reasoned that the best way to withstand the current crisis related to rising food and oil prices is to keep the economy strong. The Prime Minister pointed to government's deliberate and structured economic plan, which has allowed the island to record 8.2% economic growth. He said a major part of that plan is the continued investment in infrastructure programs, which has been a major source of jobs for citizens. This, the Prime Minister said, is coupled with social programs such as the electricity subsidy, assistance to registered transport operators, and a new social pension program for the elderly.
Jamaicans can rest assured the government's infrastructure program continues, even in a time of crisis, because it is the continued investment in the infrastructure that is going to drive employment, that is going to give the incomes, that is going to allow the households to be able to respond to the crisis.
Prime Minister Holness was speaking following a recent tour of the Maypen to Williamsfield leg of Highway 2000. Some 600 Jamaicans are employed on the project. The roadway is 75% complete and is expected to be ready by April next year. In other news, a wheat substitution program is being developed by the Ministry of Agriculture and Fisheries. Portfolio Minister Pernell Charles Jr., who made the announcement, said Cuba will be assisting Jamaica to create a gluten-free flour from breadfruit and cassava. The program, the minister revealed, is being created to stave off the current global wheat shortage while promoting healthier eating options for Jamaicans. Minister Charles Jr. says data revealed that between 2010 and 2017, obesity among adults and children has increased.
We note also the health challenges being faced by a significant percentage of our people, and with data indicating that 25% of Jamaicans are suffering from at least one chronic disease. And so we will be updating the food and nutrition security policy to boost the consumption of locally grown, nutritious foods.
The Agriculture Minister was speaking at Tuesday's handover ceremony for the Jamaica Food Systems Profile by the Food and Agriculture Organization of the United Nations. The report is expected to guide the island's plans and policies to ensure Jamaicans have safe, nutritious, and adequate food supplies. Electronic traffic tickets will be issued to persons who break road rules such as speeding, disobeying traffic signals, or operating a vehicle that's unlicensed or uncertified. Transport Minister Audley Shaw made the announcement during Tuesday's sitting of Parliament as he tabled the regulations for the 2018 Road Traffic Act. Minister Shaw says the new electronic monitoring and surveillance regulations will allow for remote detection of offences using cameras and other electronic devices. The minister also says where traffic offences are detected remotely, the owner of the vehicle will receive the tickets.
Electronic detection devices will be approved by the authority to be installed on or near a road. Some of these devices are listed in the regulations, along with the types of offenses that may be detected, including speeding.
Minister Shaw says as the program is rolled out, the regulations will be adjusted to cover any additional devices or provisions that are necessary. The electronic ticketing program is one of 299 new regulations under the amended Road Traffic Act and regulations. Finally, the island's first and only nuclear medical science facility has been reopened. The center, which is based at the University Hospital of the West Indies, was closed in 2002. It has since been reopened through the collaborative efforts of the Ministry of Health and Wellness, the International Atomic Energy Agency, the Planning Institute of Jamaica, as well as the University of the West Indies. Speaking at the official opening ceremony, Prime Minister Andrew Holness said the center's re-establishment will play a vital role in the public health system. This as nuclear medicine enables early diagnosis and treatment of cancer and cardiac conditions, which account for half of all deaths recorded in Latin America and the Caribbean.
The facility that we are opening today is an important component of any modern health service. The service will now be available locally within the public health care system, and this means that patients will be able to get this up-to-date modern service at a fraction of the cost when compared to that offered overseas. This facility will benefit our citizens and those in the wider Caribbean.
And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.